Thank you, and thank all of you. I'm Dr. Donna Galbreath. I am the Senior Medical Director of Quality Assurance for Southcentral Foundation, or SCF. I am a tribal member of the Mentasta Traditional Council. SCF is an Alaska Native tribal health organization. SCF is one of the largest employers in the state of Alaska with over 2,700 employees. We serve 70,000 Alaska Native and American Indian people providing health care. Our service area is over 100,000 square miles, which is not very small. It's basically the size of Wyoming, for another reference. We have over 85 programs. We deliver health care. We deliver primary care and dental care and behavioral health and addiction programs, just to name a few. We also co-own and co-manage the Alaska Native Medical Center with Alaska Tribal Health Consortium. Advance appropriations is critical to the stability of the tribal health care system. SCF appreciates the Appropriations Committee providing advanced appropriations to the Indian Health Service 2025 budget. These appropriations should be permanent until mandatory funding is secure. In addition, there needs to be increased funding because of the cost of medical inflation and the growth of population. If this isn't done, eventually care will be affected and the health disparities will increase. Mandatory appropriations and exemptions from sequestration are also needed. Indian Health Service is the only federal health care program that is not exempt from sequestration. The possibility of cuts leads to uncertainty in budgeting, and you all know you can't run a business without knowing your budget, so it is a big issue. SCF appreciates the committee's attention to 105L leases. SCF supports that these costs remain part of appropriations. These costs and contract support costs should be mandatory. Twice the Supreme Court has ruled that Indian Health Service should pay for contract health supports costs. Indian Health Service has actually deemed part of those costs as secretarial and refused to reimburse. These costs have been paid historically and are part of contract health support costs. SCF requests that the committee include language in the appropriations bill that requires Indian Health Service to compute 2025 contract support costs as done in 2021. The pandemic has highlighted the shortage of healthcare workers. It has also caused widespread burnout, and this is a national issue, and it's actually critical. You can't have health care if you don't have enough workers. So this is actually felt much more severely in tribal communities because it's hard to recruit and retain people in these communities. SCF has built systems internally to help with this, but additional support is needed from the federal government. There needs to be increased scholarships and increased bonuses for hiring and retention for anyone working within tribal organization. In Alaska, one of the key factors in recruiting and retention is the lack of professional housing. Indian Health Service should do a needs assessment of professional housing in Alaska and then seek funding. Behavioral health is a big issue. Some people have already mentioned that. Alaska Native and American Indian people are disproportionately represented in behavioral health issues. The drug overdose death rate in American Indian Alaska Native people increased by 39% from 2019 to 2020. That's 1 year. That's a huge increase. The suicide rate amongst Alaska Native people is 3 times the national average, and in some communities it's 6 times the national average. SCF has integrated behavioral health to try to address some of this needs, but there's only so much we can do. There's a dramatic need for increased funding for behavioral health needs. This funding should be appropriated and then distributed to all tribal health programs through formulas rather than through the grant process. Grant process cannot affect all of these things. The need is just too great. The intent of Build America and Buy American Act is appreciated, but there are financial restrictions. We know there are waivers, but those are complicated and they take a long time. So a lot of the times the construction season is missed. SCF encourages the committee and Congress to consider a narrow tribal exemption for this act. In terms of self-determination, SCF suggests that the committees for jurisdiction consider moving beyond Indian Health Service when it comes to contracting and compacting to allow Indigenous people to chart their own health care path. Thank you for the opportunity to testify in front of you on behalf of Southcentral Foundation and the 70,000 people that we partner with on our journey to health and wellness. Thanks.
Thank you, Donna.